The last joint model that I wanted to show you with some motion is the knee. So remember, we need the knee to flex, and so there's a lot of ligaments here that have to keep the knee in place, because even though it has a lot of movement to it, it still doesn't have left and right movement, because remember, it's a hinge joint. So this is the posterior side, and this is the anterior side. So on the top we have the quadriceps tendon, and below the patella we have the patellar ligament. Now you'll notice the little cushions in between. Those are the menisci or the menisci, and so they're just named after which side of the tibia they're on, essentially, which side of that articulation. So remember, the tibia is medial, right? Tim and Phil. So tibia is medial, the fibula is lateral. So this is going to be the lateral meniscus, and this is going to be the medial meniscus. Okay, since we're on the medial side, this is called the medial collateral ligament. Collateral ligaments are ones that support the side. So this is the medial collateral ligament, or you can call it the tibular collateral ligament. And so the medial collateral ligament is actually an MCL. So if you've heard of an MCL injury, it's that medial collateral ligament. On the lateral side, because that's where the fibula is, we have the lateral collateral ligament, or LCL. You can also call it the fibular collateral ligament. So I don't care which one you pick, whether it's easier for you to learn it based on which bones are here or which side it's on. Either is fine with me, but be sure to know either medial collateral, lateral collateral, or tibular collateral, fibular collateral. Okay, and then we have two that cross. So the crossing ligaments are called cruciate ligaments. So there's one in the front, and the one in the front actually comes all the way. See how they crisscross under there? They actually form a little cross. Let me see if I can prop this just right to get you guys to be able to see this. Let's see. Kind of. Okay. So let's start with the one in the back, because maybe that's easier for me to prop. The one in the back is the posterior cruciate ligament. Don't worry about this that goes to the meniscus. That's something else, and I can never remember the name of it. I always look it up, but our book doesn't have it, so don't worry about that. But this is the posterior cruciate ligament. You can see it's crossing with the anterior. It forms that cross, and it really separates us from essentially hyperextending our knee. And then the anterior cruciate ligament is coming this way and holds us in that same position so that we're not overextending our knee, where they're kept in place with those cruciate ligaments. Okay, so posterior cruciate in the back, anterior in the front that comes around to the back. It's a little bit tricky to see there. You can kind of see it in the front as well. Oops, let's see. You can kind of see it in the front as well. It's a little dark, sorry. But that is the anterior cruciate ligament. Okay, and so remember, we have fibular collateral ligament or lateral collateral ligament, tibular collateral ligament or medial collateral ligament, posterior cruciate ligament, anterior cruciate ligament, medial meniscus, lateral meniscus. And that's the knee.